Hello, everybody.
Hello.
So we're here on our weekly Facebook Live broadcast. I'm Samuel Gracida from Sam's Fans, and today we have guest music therapist Brian Schreck, and
Hello.
that's Brian Henry. And thank you for joining us today. We're mainly going to be talking about what music therapy is, who can benefit from it. Brian is going to have some great stories to share with us. And first of all, though, some of you might know Brian already, but if you don't, please, Brian, tell us a little bit about who you are, what are you about?
What I'm about, I'm Brian and I'm a music therapist. So I've been doing this in November. It'll be 14 years professionally. I've worked in Boston, I've worked in New York City, I've worked in Cincinnati, and now I'm back in Louisville, Kentucky, where I'm from, working at the Norton Cancer Institute.
Awesome.
Yeah.
So you're a music therapist, and we'll talk about what music therapy is, but um, it's also really interesting to know. And can you also tell us about why you have a connection with Sam's Fans?
Sure. I met Sam a number of years ago. I actually was her music therapist. So while she was having her bone marrow transplant, I got to serve her as a music therapist and work with her throughout that process.
That's awesome. How long
Yeah.
were you in Cincinnati?
10 years.
10 years.
Yeah,
That's a long time.
it was. Yeah.
Yeah. And with Sam, how long were you kind of working with her?
Off and on for 6 months, I would say.
Okay.
Yeah.
Would you say that you got to see her every week, or how often was that?
I would check in quite often. We would do music therapy sessions pretty often. So yeah, I would at least once a week.
That's awesome. And
Yeah.
what sort of things did you do with her?
Well, she was playing the piano before she came down to Cincinnati from Columbus. So just for normalizing, keeping things, as hopefully as normal as possible, I'd just let her borrow a keyboard so she could continue practicing anything she wanted or playing or just feel like it was something that she would be doing normally at home anyway. So that's how
Gotcha.
it began. Yeah.
Hmm. I
Hmm.
actually didn't know that she played the piano.
Yeah. So she was taking lessons, and then in music therapy, it's more of a therapeutic lesson. So I'm not going to, hold lots of rules and
Hmm.
but it's more about engaging in the verb of playing music and trying to enjoy and sit up and feel like you're really focusing on something that's not just being in the hospital, feeling lousy.
Right.
Yeah, that you're connecting with something that feels good.
Yeah.
Yeah.
That's awesome. So it started with the piano, and then do you go on to different things like writing songs or singing, that sort of thing?
Yeah, she had a beautiful little voice, and I liked to engage that as much as possible. I would play a lot of guitar. I would give her as many different instruments to try out, but the keyboard was something that she always gravitated back to.
Hmm.
Yeah.
That's awesome. And some people know about this recording that Sam actually got to make for her mom.
Yeah.
Can you tell us a little bit about that, how it came to be, and what it is?
Sure. We were trying to think about just a gift to give. So I was talking to Sam, and she said that Matt Kearney was one of her favorite artists, and I asked her to choose a song. And the way I was doing things back then, I had her record along with the actual recording. And then once I have that, I can either keep or take out the original part and then play my own on
Mhm.
top of that. So then it sounds like an unplugged version that's real simple and easy, but sounds, right in time with the actual song.
Okay, that's
Yeah.
awesome.
Yeah.
And could you play a little bit of the song for us?
Oh, sure. Let me get this up. Let's see.
The roads lead back to you. don't be bright. We can make into a brighter day. If I'm worth anything, ever goes down easy. Oh, the don't be bright. I don't understand this money road. Then worth anything, ever goes down easy.
Yeah.
Awesome.
So I love that song because it's exactly what Sam's Fans feels like to me. It goes on and on. You know, no matter what's going on, no matter how tough the road is, we're gonna keep on moving. We're gonna keep on going. Yeah.
Yeah, that's what it's about. I actually wrote a blog post about that song recently. But I would love to hear what you have to say, you know, on how the lyrics of the song and how recording the song helped Sam.
Oh, I just thought, I mean, it's so sweet to ever give your parent a present. And when you're stuck in the hospital, there's not too many things you can do. So we have to be very creative. So it's always a music therapist's job to sort of create something out of nothing and using the resources that are available. So her voice was working just fine. And it just seemed like a perfect way to connect, not just with an artist that her mother loves and still does love, but is a way to put all of these parts together and it to be just really heartfelt and from her soul to make, knowing that, you know, she was old enough to know that this is a hard process being in the hospital for her parents as well. And that it just seemed like a beautiful anthem of sorts.
Yeah.
To really keep all of our things moving, keep the faith of going through the transplant, of just trying to stay as positive and forward moving as possible.
Definitely. I think that's
and
great.
Knowing that there's going to be rough roads ahead, but you know, all the roads lead back to me, to Sam, in regards to Sam's Fans. So it's just, I mean, it's just a beautiful, I love that we did it. It didn't take very long to do. And I like that it's still one of my favorite recordings I've done.
Oh yeah, definitely. And that phrase, you know, nothing worth anything ever goes down easy. You know, I think it's perfect.
It says it all right there.
Yeah, exactly. Joe Manning says that you're a superhero.
Oh,
so.
Thanks, Joey.
Do you know?
I do. I'm in a band with him. He's one of my favorite people. Yeah.
Great. Well, hello, Joey. All right. And this is Patty. You know, Nikki's mom. Talking, you know, about Sam's voice.
Yeah. It is sweet to hear that voice. I agree.
Yeah.
And that's why I love recording, because no matter what happens, whether the best outcome is possible or the worst outcome, if we have things recorded, it preserves not just their legacy, but their essence, and you can visit them whenever you want.
Definitely. I think that's great. That's great. So on that note, let's dive a little bit deeper into what is music therapy. You know, I feel there might be some misconceptions, or some people don't really understand what it is about. So can you maybe first give us more of the textbook definition and then explain it a little bit?
Sure. I would say for a good textbook definition, you should go to American Music Therapy Association's website, which is musictherapy.org. The way I like to think of it, it's a credentialed health profession that uses music to help people. And that's really what it gets to the bottom of. We're going to use whatever we can, whether it's live music, whether it's instrument playing, whether it's trying to record, whether it's writing a song. But it's really about the connection with the human being and being a consistent support system. So it's through that relationship that these personalized things develop, which you can get to, you know, a place of finding out a person's favorite song that then you can record.
Definitely. And what do you think is the role of music in all that aspect?
Music is the bass line, or it's the drum set of the song. It holds it all together, but sometimes the music's in boldface and sometimes the therapy is. and sometimes it's a mixture of both. So to me, it's about being a human being first, being a helper first, figuring out what are the human needs that need to be met before we can dive into anything musically, whether that means getting them a blanket, getting them some water, turning the TV off, really setting the room up so it feels, as possible for therapy to happen as possible.
Yeah.
And then after that, it's really just about finding out what is important to them that day. And it's my job to create something around that, whether it's instrumental music, whether it's, figuring out a song with them, having them sing a song, or just even getting through what music preferences that they have. Because the more we learn about each other, the more we can get specific. And it's those specific things that then can be transformed into those tangible objects like a recorded song.
Yeah.
Yeah.
Definitely, I agree. I think that's great.
But it's all about the connection. So everything we try to do, I mean, the clinical aim, music is the vehicle, but we're looking at clinical outcomes, whether it's to try to help not feel as nauseous as you're feeling, whether if we know that they haven't moved a lot that day, I'm going to do my best and have a good story about that later to get them moving. I mean, there's something about music that helps us move our bodies, and people use that. So it's good to try to harness that power as well.
Yeah, and I agree. And I think that music can connect and can speak to so many people, and that's why it's also a great tool, a great vehicle, like you say, to use to connect not just with kids and people in hospitals, but in for the elderly, for people with disabilities, and different populations that you can reach through music.
Exactly.
Which actually leads to the next part, which was to talk about, who can benefit from music therapy. So at Sam Smith, we're really focused on hospitals and children with serious illnesses, but who else can benefit from it?
Oh, there's a vast, I mean, if you think of anyone that has any illness of any kind, whether it's mental or health, music therapy got its start in veterans hospitals. So working with the military, working with any kind of psychiatric disorder, like you said, any kind of developmental or different learning systems. So people, often music therapists, can work in special eds placements. Anyone with dementia of any kind, so nursing home and gerontology is another avenue. A lot of people are working with people on the spectrum of autism. So yeah, all ages. I mean, a lot of people are working in the neonatal intensive care unit. So I mean, it's from, I worked actually with people that were expecting, it was called perinatal hospice. So I was working with people that were still pregnant. So from 0 all the way to, I worked with a woman the other day that was 103. So I mean, everyone in between. So anyone that has some sort of need, I feel like this service can help in a specific way to target whatever is specifically going on with them.
Definitely.
Yeah.
So you personally have worked not just in hospitals, but with different populations?
Sure. Yeah. My first job was in special ed. And then I worked a night job in pediatric psych, and kind of like a residential unit. And then I moved on to adults with cancer. And then I worked in palliative care in New York City. And that was all kinds of illnesses. And then at Cincinnati Children's, I worked with pediatrics with any reason to be in the hospital. I would focus on people that were going to be long-term patients, so that relationship was there and that it could really be a meaningful service to them. And then I did home hospice, and now I'm back in with young adults and and up with cancer diagnosis in an
Okay.
outpatient. So yeah,
Gotcha.
a little bit of this and a little bit of that.
Right, definitely. So, what drew you to work in hospitals and, especially in pediatrics? Sorry, and that sort of population. Well, what does that look like? What we've already talked a little bit about what you did with Sam, but what else does music therapy look like there, and what drew you to that?
Well, the hospitals are always a place that no one wants to be.
Mm-hmm.
So to me, that seemed like a perfect place for me to spend my time. There's something that's intriguing about all of the reasons for being inside of a hospital, and working in pediatrics and with adults. The work is pretty much the same. It's still all about the relationship with that person. But what it looks like is a little bit different, even every day with the same people that you might be serving.
Mm-hmm.
They might be getting better, or they might be feeling a little bit worse. So it's kind of going with the flow. I think improvisation is a key philosophy of not just a music theory, but as an actual philosophy of life in the hospital. You gotta go with the flow, and if you have a plan, it's certainly going to change once you actually get on the floor with these people that you're trying to help. But to me, there's something therapeutic about being there with them and being present first, so that it's obvious that you're only there to help them. And once that is communicated and that connection is made, then the real stuff can start to happen. Then they start talking. In pediatrics, there's a little less talking, depending on their age. But the older that they get, the more often that they will share things that are maybe worrying them or bothering them, or wishes for the future and hopes. So yeah, trying to connect all these healthy parts of living and doing our best to recreate that in some way inside the hospital. And that could mean hanging up pictures of their favorite artists. I often would, find out who they love the most, and then I would make a kind of a silly printout of that person's face with a little side box that said, "Hey Sam, I hope you're doing good today. I love you. Love, Matt Kearney."
Right.
Like things like that they could hang up. This is kind of a reminder that we're going to get through this day. We're going to get through every day, and we're going to do our best to even have this much of fun.
Yeah, definitely.
It's kind of hard to do anytime in the hospital, but once they get to know me, and once I get to know them, and there's a comfort there, then we can kind of go for the stars and figure it out together.
Definitely.
Yeah,
I think that's great. And I actually got to see a little bit of the music therapy at Nationwide Children's in Columbus. And I definitely saw all the things that you're talking about. But I also got the sense that, music therapy is being more prevalent in hospitals. But I still get a sense that perhaps we could use more. Or what do you think as a professional? What's your point of view?
Oh, sure. So even at this part of my career, where I've been doing this almost 14 years, I serve basically 4 different hospitals here in Louisville. It's all related to Norton, but they're separate entities under the same umbrella. So I have many patients I could see, too many to see every day. And the more the merrier, because I think it's more about quality than quantity. And I do believe that it takes you have to be a great musician to be a good music therapist. So there's all these parts that are working together of, just normal relationship building skills, your comfort level with things that some people might find upsetting. Because every day in the hospital is pretty tough. And there's trauma happening just from being in the hospital. So yeah, helping out with blood draws, helping out with, on your way down to surgery while you're waiting. So any of the pre-anxiety things that are happening, if we can do anything to help reduce that stress, is always important. And it helps all parts of the medical team. And then if we're thinking more of the inpatient side, it's really just about getting through the day and trying something new, feeling alive. If they're old enough, learning an instrument can be a skill that they feel proud of, so that they could potentially do forever.
Right.
Yeah. So, I mean, there's all these little bits and pieces, but it takes a while to figure what is important to them out so that you can really tailor these experiences to match that and then move that forward.
Definitely.
Yeah.
Yeah, I agree with you. And recently we looked at some of the music and art therapy programs in different Ohio hospitals, and we're definitely seeing a trend of more music therapy and more art therapy. But I agree with you, that is finding quality music therapists, but then also making sure that, everybody who might need or who might benefit from music therapy has access to that. So I think it's definitely a fight worth fighting for,
100%. And part of that's also getting very much in tune and aligned with some of our bigger medical personnel, which could be big doctors, nurses that can give wonderful referrals.
Yeah.
So yeah, the more involvement and collaboration and co-treatment we can have with them, the more it makes sense to the patient as well.
Definitely.
So I love walking into a room and knocking on the door and saying, "Oh, I work with Dr. LaRocca and I'm here to see you." And that comes with a whole different feeling than I'm Brian from music therapy.
Right.
If that makes sense. So it's coming in with the clout of the whole medical team behind you to support not just what we're doing, but to let them know that this is important for them and their doctor believes so as well.
Yeah. I think that's great. I totally agree.
So yeah, as many advocates as we can have internally helps with external growth as well.
Definitely.
Yeah.
And with that, I think it would be great if you could share some stories with us of some patients you've had, or I'm sure you have many stories, so maybe just a couple.
Sure. Since we're talking about pediatrics a little bit, one of my favorite stories, I was working with this little boy named Tony, and he had brain cancer, and he wasn't he wasn't in the mood to do anything. So he was hiding under the covers, and I slowly started I have two little boys, and at the same time, one of them was around the same age as this little guy. So there's something just that I was bringing from my real life experience as a young parent of what would I do if this were my little boy. Right. And I just started stacking little instruments on top of him. And he started peeking out like, well, what in the world are you doing? And then I started showing some things and then playing a little bit. And then he started to come out. So now his face is out from the covers. And then about 10 minutes later, he was sitting up and he was trying out some things with me. And then about 45 minutes later, he was up and standing and dancing to an original song that his mom had written for him. And so from going from hiding under the covers to up and dancing within 45 minutes, to me is a perfect example that in a short amount of a time, really a whole lot can happen.
Yeah, I think that's great. I love that story.
And another one I was working with in my internship in New York with a woman named Victoria, and she was around 34. At the time, I was only 22. She had pretty significant breast cancer, was feeling really lousy, and I showed her an ocean drum, and she's from Puerto Rico, and she started telling me all of these stories about when she was a teenager on the beach and sneaking out, and fruits that they would grab off of trees, and these thoughts and scents and sensations that she had not thought of in quite a long time.
Mhm.
And I could tell just in her telling me these things that she was kind of re-experiencing it as well. And then in a short amount of time, I was showing her some different things on some instruments, and she started to dance. So she was up and playing this hand drum that was pretty loud. And it you know, these are glass doors. It's a pretty quiet place, and doctors and nurses were walking by and being like, what in the world is going on in there?
Right.
But they knew her, and they knew how terrible she felt. And the fact that she was up and sort of improvising vocally and singing was just, I mean, it was a memory that I will never forget. And I remember as a young professional being like, this is what this is supposed to be about.
Right.
Yeah.
Yeah, I think that's great. Nikki is a little bit late, but she says hi.
Hi, Nikki.
I'm sure she'll be able to see the repetition later.
Yeah, it's good to see you.
All right. Awesome. Do you have maybe one more or?
Sure. I've been doing a lot of work recently with heartbeats. So we like to pick up every part of the patient that's working. And sometimes when there's an inability to speak or verbal, you know, any sort of verbal language is difficult, we can still communicate through their natural rhythm. So I have different stethoscopes, but here's my favorite one. And it's a little digital one, and I can hook it up straight into my computer. I can use external Bluetooth to put it on a patient and then have this far away so it won't feedback. And someone can hold this on the person, and then through this you can hear their real live in sort of this weird sound, their heartbeat. They can help us keep the rhythm for a live music, you know, intervention. And it goes really wonderful with making recordings that can be just as important as the one that we heard earlier with Sam singing.
Yeah.
So if we can get the patient also singing on top of their heartbeat, that's amazing too. So it's really just using all the parts that are working with them. You know, people often say to me, I don't have any rhythm, and I like to come back with saying that you have an amazing rhythm that's keeping your whole body moving right now.
Right.
And all these thoughts alive in your body. So helping them understand it. So it can be a really sweet thing to even start out a session with when things are going great, of being like, listen to this. You have a really unique rhythm, and let's play around with it. And so once we have that, and we can edit it, we can loop it, we can add different family members' heartbeats to it and really create wild things, sound collages. But yeah, it's I'm excited about it. We're doing some good work about that. We're trying to make a documentary out of it.
Awesome. That's great.
Yeah. So yeah. I'm in the process of creating a website because there's a lot of music therapists that ask a lot of questions about this. So this could be a nice way to communicate with them in real time and troubleshoot and add new ideas and help each other out. And then, just trying to make music therapy as real and open to the public as possible so that they can see it with their own eyes. You know, there's tons of papers about music therapy. There's wonderful things like this that we can talk about it, but people really need to see it sometimes to understand what exactly this means.
Definitely.
Yeah.
Yeah, I think that's a great initiative. And if you need support from Sam's fans, definitely let us know. I think that's a project that definitely aligns with our mission, and it sounds great. We'd love to be involved.
Well, cool. Well, if you're interested, check out thebeatoftheheartmovie.com.
Okay. I'll do that.
Cool.
And Jeremy says hello.
Oh, Jeremy. Oh, it's so cool to see you, Jeremy. Jeremy's I worked with Jeremy's son up in Cincinnati as well.
Awesome.
And Jeremy was wonderful enough to do a lot of the first interviews and talking about the heartbeat recordings.
Oh, okay. Great.
That was a number of years ago. So I think, So it's always lovely to hear from you, Jeremy. I hope you're doing good, buddy.
Awesome. Let's see. Now we have more comments. If you have 5 more minutes. Well, Nikki just says that she's listening. She's happy you're here. That's right.
I'm honored to be here, Nikki. I'll always do anything for you I can.
Then Sean says, "Hi Schreck, love you, buddy."
He's an old music buddy from Boston. He lives out in California now. He's a great musician and a real great guy.
Awesome.
So thanks. I love you too, Sean.
And then we have Stephanie Miller. I was one of those MTs asking you about heartbeat. Just got my stethoscope and materials and recorded my first heartbeat. Excited to see what comes of this.
Oh, congratulations, Stephanie. If I can help you in any way, let me know.
That's awesome. Yeah, I think definitely Nationwide has some of those stethoscopes that they use. But I would love to see how we can support that initiative more. I think it's great.
Awesome.
So we're coming here to close. If any of you wants to know more about the things that we support at SAMS Fans, we're in Ohio hospitals funding music and art therapists. We also buy music and art supplies for these hospitals and for different programs. We have funded different camps for children with serious illnesses and different initiatives like what we're doing here. This is part of our mission, which is to inform people about what music and art therapy are, and so that we, like you say, so that we may all, that it may become real for more people and that they might be able to experience this. So if you're interested, check out our webpage, samsfans.org. And thanks for watching.
People can email me if you want.
Definitely.
You can see that.
I can actually type it. 1 second.
Okay.
That's Brian.Schreck at nortonhealthcare.org. Is that right?
You got it.
If you're interested in some of these projects or getting in contact with Brian, that's the email. And thank you so much for joining us today. I think it was a great conversation.
Thanks for having me, Samuel.
Definitely. And looking forward to working more with you and sharing the love of music therapy.
Same.
Great. And with that,
buddy.
Goodbye.
There we go. I'm sitting at my piano.